Hello, my name is Cheryl Richardson, a student of Aspen University. Today I will be discussing an action research problem and study. The problem to be solved is the high incidence of pressure ulcers in a long-term care facility. Pressure ulcers, also known as bed sores, are damage to one or more layers of the skin that cause pain, immobility, and delay in recovery. Pressure ulcers develop in various areas of the body. The overall nutritional state and health of the patient determines risk factors. The common cause of pressure ulcers is decreased skin care and not frequently repositioning the patient to relieve prolonged pressure on an area of the body. A pressure ulcer can develop in as little as a few days and can be seen as neglected care and avoidable. These injuries are preventable with early detection and effective treatment plans. Research indicates that 2.5 million patients per year experience hospital-acquired pressure ulcers in the United States. Treatment for pressure ulcers can cost as high as $70,000 per instance. Medicare and Medicaid do not cover these injuries. Each year it is reported that 60,000 people die from injuries related from pressure ulcers. Pressure ulcers are the second most common hospital lawsuit claim for wrongful death. Prevention is a priority to avoid these injuries. The goals I wish to accomplish with the action research process are increase interaction and communication among the healthcare team, meaning the nurse and the patient care techs, to demonstrate how the benefit of an additional staff member for turning patients every 2 hours in daily skin assessments can create opportunities for increased quality care with focused care. Provide indicators of detection to avoid initial stages of pressure ulcers. Encourage use of standing protocols for use of skin protectants. And show cost effectiveness with prevention. The stakeholders that need to be involved with this action research process are the leadership of the facility, director of nursing, all nursing and patient care techs, and patients. Commitment to change requires understanding the importance and participation of everyone. There will be known and unknown obstacles as the research unfolds factors that contribute to the development of pressure ulcers. Understaffing, high staff turnover, and staff with limited knowledge are reported barriers for non-compliance of guidelines for prevention of pressure ulcers. Implementation of an additional staff member as part of the action research plan will circumvent some of these obstacles. Leadership must maintain commitment for improvement with addressing staffing shortages. This is an important part of the proposed solution. The action research process will begin with selection and approval of 3 long-term care facilities to conduct the research. A meeting will be conducted with the Director of Nursing for their buy-in and approval for each facility. The purpose and evidence-based research will be discussed to support the ongoing problem with pressure ulcers in nursing homes. Solicitation of staff to participate and commit to the entire research study will be completed through face-to-face interviews using a template of probing questions for consistency to identify specific themes to categorize responses. As an incentive for participation, staff will be given time off. During the first participant group meeting, the researcher will review the healthcare practices and procedures of each facility, observations of patient care techs, review of roles and responsibilities, assessment of staff-patient ratio and acuity levels for immobile, bedridden, and patients with severe mobility limitations. Staff will complete a questionnaire to assess their knowledge and care of pressure ulcers, duties, and time management. Training will be conducted by a wound specialty care nurse or tissue viability nurse, focusing on risk factors of altered skin and tissue damage and signs of behaviors that contribute to development of pressure ulcers and the importance of adherence to personal care practices and procedures. A post-test will be completed at the end of training. Participants in the study will meet with researchers every week to discuss patients at risk and those with a current pressure ulcer. The researcher will guide the discussion to allow staff to express their ideals, recommendations, and observations of implementation practices. The researcher's assistant will help gather data and feedback from other staff members. A prevention patient care technician will be designated by each facility specifically for this new role to assist with prevention measures of pressure ulcers. The researcher will follow up with the actions and duties of the prevention patient care tech and meet weekly to update or revise the patient's preventive treatment plan. The prevention patient care tech will use a schedule and document repositioning patients every 2 hours, skin assessments, use of skin barrier products as needed, and immediately report any changes in tissue or skin appearance. The researcher will observe and track prevention and improvement of pressure ulcers with implementations completed by the patient care tech. The data will be analyzed, treatment plans will be continuously reviewed, and actions revised to address individual care needs and coordination of care based on the overall input from the participants. After 4 weeks, the researcher will review notes, analysis of data, patterns of behaviors, and provide a cost analysis associated with the additional patient care technician for prevention when compared to the cost of a single instance of an acquired pressure ulcer. The evaluation process will be based on the effectiveness in sustaining no new pressure injuries and treatment of existing skin alterations. The result of the action research process and implementation of a solution will meet the objectives of the study for prevention, increased communication, and quality of care for patients. The implementation of the changes will be more cost effective for the long-term care facility and impact the care and lives of the patients. This concludes my discussion of an action research process that can prevent or effectively treat pressure injuries while impacting staff shortages, increased communication, training, decreased stress of staff, patients, and families, and most importantly, reduce liability of unnecessary costs, injuries that impact patient lives. References can be found at the end of this video. Thank you so much for listening, and have a good day.